Advocating for one's health is important for everyone, but it is especially important for women because of our unique health challenges. One such challenge is metastatic breast cancer, MBC, which remains an incurable disease in need of further research and support. Dr. Mita Manna is a medical oncologist at the Saskatchewan Cancer Agency and joins me now to share information you need to know about MBC. Welcome to What She Said, Dr. Manna.
Thank you, Candace. Pleasure to join you today.
So can you start by explaining to me what metastatic breast cancer is and how it differs from other types of breast cancer?
Absolutely. That's a really good question to start with. So I think it's important to understand that breast cancer in general is one of the most common cancers women in North America would be diagnosed with. About 30,000 women each year would receive a diagnosis of breast cancer, but only about 5% may have a diagnosis of metastatic breast cancer. And the difference with metastatic breast cancer versus other stages of breast cancer is the fact that the cancer has spread beyond the breast and the lymph node area. So it could have spread to other areas in the body. For example, the liver, the lungs, the bone, and rarely the brain as well. So that's the difference between metastatic breast cancer and early stage breast cancer. It's also important to know that when we're dealing with metastatic breast cancer, it's often an incurable setting as well.
So I just want to make sure that I'm understanding this. It starts in the breast and spreads elsewhere. It didn't start somewhere else and go to the breast, right?
Correct. Absolutely. So the origin of site is in the breast, and then it will spread, often migrating towards the lymph node, and then can spread to other areas of the body. So if it spreads to the bone, for example, often people might mistakenly call it bone cancer, but it's still breast cancer that is now involving the bones. So that's important to understand.
Okay, so we've established that most times it's incurable. So can you discuss some of the advancements that's happened in treatment over recent years?
Absolutely. So in the world of oncology, it is rapidly evolving, and we've definitely seen a lot of advancements in the clinical setting as well as through clinical trials. There have been several new advancements in the world of breast cancer. Often people think that the only type of treatment that's available is chemotherapy. But when it comes to other treatments, we now have the use of certain targeted therapies that specifically target the cell and kill it off based on the cell cycle. We have other therapies that are activating our immune system, such as immunotherapy. And we also have other novel agents that are coming down the pipeline where they target specific receptors and essentially deliver a payload that could kill off those cancer cells, and those are called antibody drug conjugates. So we have seen a development of multiple agents over the past decade in the world of breast cancer, where these agents can be tailored to each patient appropriately, and patients are receiving appropriate treatment. They're maybe living longer with metastatic breast cancer and with a better quality of life.
Now, I've had a few people on to talk about metastatic breast cancer over the years, so I feel like I'm pretty aware of it. But why do you think there's a general unawareness amongst women on this specific type of breast cancer?
Absolutely. And I think there's been a lot of awareness when it comes to breast cancer in general. Like I said, it's a very common cancer amongst women, and often you might know a loved one, a friend, or a colleague, someone who has been affected with breast cancer. But as I mentioned, majority of the time it is early stage breast cancer, and metastatic breast cancer is only a small subset. And often this is not spoken about or talked about. And a lot of patients might feel isolated, and there might not be a lot of awareness around metastatic breast cancer. So I think it is important to have these conversations, bring awareness to the general public so people are, more readily able to have these conversations and learn about metastatic breast cancer and enter that unknown area.
We talk about advocating for our health a lot. We say those words, but what does that mean? What does that look like?
That's a really good question. So what that means is really being involved in your health and treatments that you are receiving. And it's important, for example, let's say a patient notices a lump or something new that's out of the ordinary. It's important to recognize that this is not, normal, and don't be afraid to bring it to the attention of your healthcare providers, whether it's your family doctor or your oncologist. So important to really mention, something that might be new or something that's causing you concern. And the other important thing is also being able to recognize what's important to you. What are your goals and your wishes when it comes to treatment and treatments received? Often, some people might sit in the doctor's office and say, I'll be happy to receive any treatment that you recommend. But at the same time, it's also important to explore what are the best options for me and what fits with my personal values. And so remember, it's always a shared decision making between the patient and their treatment team. But ultimately, the patient is the center of all management. And so really you as the patient is the driver and moving things forward in terms of what fits with your values.
So I imagine as a woman, though, being diagnosed with MBC, that must be a very frightening time. And we do defer to our doctors and the experts. So there might be some fear in sort of pushing back on the advice. What would you say to that?
Absolutely. And I think any diagnosis of cancer, and especially with metastatic breast cancer, is life-changing. It's life-altering, right? And ultimately, us as a healthcare providers want to give the best options, tailored to each individual based on the cancer itself and the biology and the details, because not all breast cancer is the same, but also taking into consideration socioeconomic factors as well, right? So when you're dealing with, let's say, a woman who might be, in their 30s or 40s and factoring the fact that they might have children or they're still actively working, or, an elderly woman who might be in her 80s and might not have as many supports in place. So it's important to really look at the patient as a whole to be able to provide appropriate treatment. My role is not just to provide a menu of options and say, okay, these are the possible options, now you choose, right? We have to be able to appropriately select what options would be best for each individual based on the evidence that's out there, and also taking into those factors for each individual patient as I described.
So for all the women who are listening right now or will listen down the road to this interview, what is the key thing you want them to walk away knowing right now?
I think it's important to understand that, metastatic breast cancer is an entity and it is life-changing. But the importance to know is that there have been several advances that have come, in our oncology world in the treatment for metastatic breast cancer. And it's important to understand that there are treatment options that exist and that patients are living a lot longer with a better quality of life with metastatic breast cancer. And it's important to talk to your healthcare team about appropriate options that are available and express what your values are as well so that they align appropriately. So I think it's important to know that, chemotherapy is not just options, but there are several treatment options that are out there. Always inquire about potential clinical trials that might be open in your center and what other support groups might be also available as well, so that you can be connected with others who are going through the same journey as well.
All right, excellent. Well, if people want to know more about this for either themselves or somebody they love, where can they find out more information?
A lot of good reputable resources online. I do encourage you to check out mbctime.ca. You can also find my personal site on LinkedIn at Dr. Mita Manna. I do hope to have more social media resources available in the future, so please do stay tuned for that, and that will be associated with my LinkedIn profile.
Okay, wonderful. Dr. Manna, thank you so much for joining me today.
Thank you for having me, Candice.